This is my audience. Sorry, pan slowly.
Okay. There are many individuals that would agree on a hot summer day, there's nothing more refreshing and better than being able to cool off in a pool or at a beach. Now imagine this. It's a scorching day in the middle of summer. You're walking by a pool, watching your friends and families relaxing in the cool water, when suddenly you lose your footing. You impact the water with a loud splash, and for a second, you have no idea what's happening. You're completely frozen, shocked at the sudden change in temperature as the cold waters surround you. As you finally realize what's happening, a swell of fear and panic begins to overcome your body. Upon instinct, you attempt to take a breath, but instead of air, you feel the same cool water running down the back of your throat and nose. Your lungs feel as if they're on fire, and that's when you begin thrashing for the surface. Aquaphobia, also commonly known as hydrophobia, is defined as the fear of water, more specifically, the morbid fear of drowning. When one thinks of drowning, the notion of being trapped underwater, deprived of oxygen, comes to mind, and that thought alone is extremely terrifying. Now again, picture a child in a pool. It happens all the time. They overestimate their ability of swimming and somehow end up inhaling or swallowing some water. They struggle a bit, they cough, then everything is fine, and they go about their business. Several hours later, that same child is exhibiting a sudden change in their behavior that would not be considered normal. They're extremely tired, seemingly having a difficult time breathing, and have developed a strenuous cough. Many parents would chalk it up to being overly tired from a long day in the sun, or perhaps the child is still trying to cough up some water from earlier. However, both doctors and lifeguards are warning parents of an out-of-water drowning phenomenon known as secondary drowning, or delayed drowning. A rare but potentially fatal reaction the body can have to what many would perceive as a harmless water mishap. So what exactly is secondary drowning? The World Health Organization defines drowning as a respiratory impairment from either an immersion or submersion in liquid. While secondary drowning and delayed drowning are not official medical terms, nor are they an actual diagnosis, they are just as dangerous as a typical drowning or wet drowning. Secondary drowning occurs when a small amount of fluid is inhaled into the lungs, usually after a struggle or near drowning. Then, depending on what is in the fluid, it can have numerous effects on the lungs. When liquid is introduced into the lungs, it irritates the tissue, which then causes inflammation. The body's natural reactor kicks in, and the lung tissue begins to produce more fluid, eventually creating what is called pulmonary edema. Pulmonary edema, or the accumulation of fluid in the lungs, can later result in cardiac arrest, since oxygen is being prevented from entering the bloodstream, which eventually stops the heart from beating. So a person who has experienced a near-drowning incident, or even just accidentally inhaled some water, can be out of the water for several hours, but because of the body's natural reaction to fluid in the lungs, it is still very possible for that person to drown. Along with having a better understanding of what secondary drowning is, it is important to know what signs and symptoms to look out for after a close call in the water. According to Allison Osinski, a water safety expert and president of Aquatic Consulting Services, a person can often appear normal immediately after the incident. Symptoms of secondary drowning can appear 1 to 24 hours after the close call, and they can include persistent coughing, shortness of breath, chest pain, extreme fatigue, fever, and unusual mood changes. If the symptoms are caught early, doctors are able to execute a treatment plan by administering oxygen and using diuretics and positive air pressure to try and remove the fluid from the lungs. However, if left untreated, Osinski said that it is very likely complications will develop and progress to pulmonary edema, evidenced by a pink frothy discharge from the victim's nose and mouth, hypoxia, respiratory and cardiac arrest, and eventually death. While it may not be easy to spot certain symptoms, especially in young children, it is imperative to look for these symptoms in anyone who may have had trouble in the water. If you notice any signs of symptoms stated, it is urgent that you seek help or go to the emergency room immediately. When regarding secondary drowning, time is of the essence. To this day, drowning remains a serious problem, especially for children, and while the Center While the Center for Disease Control and Prevention doesn't separate wet drownings from secondary drownings for their record, it is reported that almost 4,000 people in the United States die from drowning each year. Of course, the easiest way to avoid potential drowning would be to practice proper water safety. Gerald Dworkin, a water safety expert and developer of a safety training program for life-saving resources, states that people, especially children, need to be supervised around the water with vigilance, even if there are lifeguards present. It is important to keep a close eye on children and inexperienced swimmer in the water, and to teach swimmers how to blow water outwards. Swimmers should also know their limits and know not to panic in the water. Preventive measures also include knowing CPR, teaching young children to be water safe or to swim, and making sure that young children cannot easily access swimming pools to prevent them from falling in accidentally. So regardless of whether someone knows how to swim or not, secondary drownings can happen to anyone. It only takes a couple seconds for someone to inhale water, either due to a near-drowning incident or a sudden rush of water. As I've previously mentioned, it is very often that the swimmer appears fine immediately after the event. But over time, the water in the lungs acts as an irritant and begins to cause edema or swelling. Remember that if you notice any symptoms such as shortness of breath or unusual changes in behavior, it is crucial that you seek medical help immediately. Even if you are not sure if a person is showing symptoms, especially regarding a child, because they're kids, they are crazy, they do whatever. It is the most important thing you can do is to trust your instinct. As the old adage goes, it is better to be safe than sorry.
All right, and I'm gonna record you guys one more time. Here's my crowd once again, minus the baby. All right, thank you guys.